Okay, hello everybody in NuSpine land. Jon Jones here, Director of Clinic Operations. I'm excited to have a quick interview here with one of our leaders, Dr. Michael Weinberger. When we transition into that maintenance world, right? You know, that patient kind of comes in initially, oftentimes with a specific symptom or pain that they're looking to alleviate. And then obviously we want to address that, but then we of course want to help that patient transition and ultimately make a commitment to being proactive about chiropractic care and using chiropractic care as a wellness approach to their health and well-being. And that's not the easiest thing to do. You know, patient communication, as we know, it's critically important, but particularly in our model with being wellness cash-based here at NuSpine, how is it particularly important, and in what way is it differently important in NuSpine perhaps than other chiropractic clinic environments?
NuSpine is a wellness maintenance care kind of clinic. In traditional Western medicine, you get an infection, you take your antibiotics for 5 days, thank you so much, don't get infected again, and we'll see you later. But when it comes to chiropractic, especially wellness chiropractic, now you're in what we would consider a physical modality. A lot of chiropractors use these sort of analogies of, you know, you don't just go to the dentist the one time and then never brush your teeth again. You don't go to the gym one time and you're in great shape and you never work out again. This is something that we really need to communicate with the patient right in the beginning, right off the bat. During the initial evaluation, we have to explain the 3 phases of care and get very, very detailed about how maintenance and wellness is going to be part of this program. We're going to get you out of pain. We're going to train your body to stay out of pain. And then we got to keep you there.
It seems like sometimes there's this approach where people are kind of like, okay, I first need to address their pain. And then once I get them through that, then we'll kind of start a communication track talking about maintenance. Are you're suggesting we got to combine the two?
Yes, the way I always talk along those lines is I use a caveat at the end of my treatment plans and my statements when I'm talking. This is something that is based around the 3 phases of care. My big introduction is you're in the right place. I know what's wrong with you, and I know I can help you. Then I'll say, now we got to retrain you so your body can accommodate to this and you're not going to be in pain anymore. What I always want to address with people is the maintenance. And I'll go into the whole, like I was just discussing with you about working out, but I'll say, we'll cross that bridge when you're there. Right now, let's focus on getting out of pain. And then we're going to talk about maintenance care. The good news is we're going to go into maintenance care and you're going to tell me how often you need to come in, because you're going to feel at this level with chiropractic care and you're going to feel like you do right now without chiropractic care.